Today we'll be discussing coping skill training in children with trauma. In the present study, I introduced coping skills to children with trauma in order to improve their interpersonal interactions. I hypothesized that negative response behaviors would decrease in interpersonal interactions after the introduction of coping skills in children with a history of trauma. Complex trauma occurs within a child's caregiving system and can have a detrimental effect on the child's development. One area in particular is the biological development. When a child feels unsafe, they can develop a constant state of hypo or hyperarousal, which is a survival mechanism. When a child's using a survival mechanism, it's harder for them to use higher cognitive functions such as self-reflection, self-regulation, and problem solving. These in turn can facilitate the development of problem behaviors. Now, when a child experiences trauma, that doesn't necessarily mean they will go on to develop problem behaviors. What typically happens is there's a lack of what literature calls ARC, attachment style, self-reflection, and competency. Trauma-sensitive programs tend to aim in the development of these characteristics. One in particular is called the restart model. This also aims to interrupt the child's conflict cycle. The conflict cycle is a negative response progression that occurs when a child has an emotional trigger. These characteristics can be expressed as anger and aggression. Other research, such as anger management and mindfulness methods, have shown a decrease in anger and aggression with the use of their methods. The present study was a single subject design with an 8-year-old Latino male who attended a trauma-sensitive program for students with behavioral challenges. This school was a therapeutic environment that used the restart model. My study was a 4-phase design. A, B, BC, and BCD. A corresponded to baseline, and each of the following corresponded to a skill that was taught once a week. And B corresponded to mindfulness, C corresponded to walking away, and D to communication. This was introduced in the independent variable with 2 30-minute intervention sessions that were instruction or review, both having a role play component. On session 10 started the implementation of daily reminders. Within the study, response behaviors were measured. It was measured whether the student responded positively or negatively, and in those situations, if the student appropriately used a coping skill, which skill, and the level of independent use. I collected data for 1 hour, 4 days a week. In this, I observed interpersonal interactions that my participant had with others. After the implementation of the intervention, if the student became frustrated, they were cued as a reminder of their emotional toolbox. Again, there were 2 30-minute sessions per week, and in these sessions, students were given physical representations, which you can see to the right, of their mindfulness or of their emotional tools. In these sessions, it was also noted if the participant correctly demonstrated the skills in and out of context. After data collection, results indicated that phase A or baseline had the highest level of negative response behaviors. This can be seen either in the graph here at the highest point or with the highest level mean. In phase B and BC, there was a reduction of negative response behaviors to below 15%. And although there was not a stable decrease of negative response behaviors throughout all 3 phases, the negative response behaviors never surpassed 50%. Overall, our results did not support the hypothesis since there was no stable decrease, and the participants struggled to generalize these skills outside of the intervention sessions. However, they could effectively demonstrate the skills in and out of context within the intervention sessions. This intervention was taught to a whole class, and I was given staff feedback, which I would love to talk more about if we had time. Some limitations to consider in interpreting these results is a time constraint. Students were not given sufficient time to master each skill within each phase before moving on to the next one. This could have impacted their ability to generalize outside of intervention sessions. Future studies should look at more time in each phase or possibly focus on just one or two skills. This is the end of my presentation. Thank you.